The third talk and the last one is on the theme of digital health on IT. That is an important, that has an important role in the health technology. And the speaker is Michael McCoy, and is up to you, Mike.
Thank you very much. If we can have the first slide, please. Thanks for the participation here. I'd like to start the stage a little bit by letting you know where I'm coming from in these discussions. So I'm Michael McCoy. I'm an OBGYN physician. I delivered babies and operated more than 2 decades before moving into the corporate world of technology, working for 2 national electronic health record vendor developers, a national consulting firm that helped in change management, then went on to a large healthcare provider world. I was the chief medical information officer for a large hospital system in the United States. We had 40 hospitals in our deployment, and I implemented 20 hospitals with 3 different electronic health record systems, 13 different ambulatory systems, and clinic systems. And I know that's crazy. I tried to get leadership to understand the waste of not standardizing. Unfortunately, I was not successful in that. And like everybody knows, there are many, many times when you know what the right thing to do is, but it just doesn't happen. Likewise, I then moved to work in the US government as the Department of Health and Human Services, Office of National Coordinator for Health Information Technology, or ONC, where I was the Chief Health Information Officer. I've been involved in the standards world. I'm the co-chair of Integrating the Healthcare International, IG International, which is a global standards development organization. And I've advised several governments, agencies, and several governments across the world on cybersecurity in the healthcare space. So basically, I've worked as a physician in the Army, a real-world physician in private practice. I've been in technology and consulting in the government. So the views that I'm expressing here are my own and shaped by these experiences. So I want to discuss several topics I think that are relevant to the changing landscape that's been brought on in large part by the pandemic. We have the federal needs versus local needs, security, short-term needs versus long-term value, and leadership values. You all have the ability to work with clinicians of all sorts, physicians, nurses, pharmacists, and help them understand the realities. Next slide, please. COVID-19 has upset a lot of the planned investments that were going on. And large organizations and countries have budgets that are set far in advance. Most are not superbly flexible because most bureaucracies are not agile in any way. So as the focus shifts to defining more urgent and immediate needs, the clamor is for things, for shiny silver bullets, for some kind of technology to put in. So let's buy more ventilators, let's build more hospitals or more emergency rooms, or put in some isolation wings, or let's use telemedicines. And while some of these may be necessary, it often means that people are sacrificing long-term plans. Building programs have been diverted. New equipment purchases or upgrades or maintenance have been deferred or abandoned altogether. Next slide. And from the government's viewpoint, population health concern is and has to be different than it is for the local healthcare delivery systems. The country or system perspective is about the overall care delivery. It's about the cost. It's about outcomes in general, and it's also about political optics. How is this going to look in time of re-election, or how it's going to sit with the voters? So the local care delivery, though, is a little more reflective of not only the local care, but also local disparities, be it social, racial, financial, location-based. Local delivery systems can be more attuned to the local needs, but they aren't always. So it depends on the environment in which you are in. Next slide. So let's also discuss then some of the security aspects from this pandemic. This hurried, we need to put in the new thingy or the new system right away is a hacker's delight. And nefarious actors are using the pandemic as cover to attack. Healthcare delivery providers are being attacked, including physician offices, hospitals, researchers, pharmaceutical companies, medical device manufacturers, and actually medical devices that are deployed in hospital settings. There is a term called spear phishing, where you use social media to find out something about the individual in an organization that you're trying to attack. And now social media attacks are higher with all the funding that's being dumped into healthcare organizations or into other systems, and that's a global problem. The United States government itself has put out a number of public warnings on these concerns, as the next couple of slides will show. So if we can go to the next slide. This is a notification about cyber actors with biological and COVID-related research. Next slide. We also have it targeting teleworking employees through fake termination phishing emails and meeting invites. So people asking to meet with you to talk to you about why you're being laid off or terminated, etc. Next slide. And so as a hacker's delight, why is that important? Well, adding the emergency thingies now, the IV pumps, the ventilators that are later open doors to hackers, leads to the ability to have ransomware or malware that comes in and can completely lock out systems or put such a high financial burden on that it is a requirement that in the United States we've had both hospitals shut down as well as physician offices shut down because the electronic health records were compromised. So that's a significant risk, of course, for that. And that's where your partnership with leadership and leaders in your organizations can help mitigate some of these challenges. As has been discussed earlier in today's program, having the credibility to speak to leadership is essential. And if your thoughts and opinions are dismissed or not considered, considerable harm can follow. If you're talking about why we need to be a little slower in rolling out some of these network changes, or we need to make sure that we purchase ventilators or things that have the appropriate security built in, that's something that needs to be listened to. Next slide. We also think about the value proposition sometimes about what are these short-term needs versus the long-term value. And so whether you're spending dollars or euros or pounds or whatever now to save lives versus saving lives later, there's a political cost to doing that. You don't want to be seen as not doing the right thing now, but you also have to understand that there are going to be costs to deferring some of those things, whether it's mitigating your security lapse because you didn't have the right security put in. If it's buying non-standard items that you're now going to have to figure out how do you do repairs and maintenance and service and all those things that you have to be concerned about, but that also have cost as part of that process. And with the next slide, we can think about, how do we deal with leadership in times of crisis? Communication is the key. And that's where you having a good rapport with your clinicians to help give them the bad news, just as they're going to give you the bad news. You need to be honest and transparent in how you convey things. Part of that is admitting when something is an unknown, or particularly in the term of science today, as with COVID and flattening the curve, you have to understand the values of R0, the infectivity rate, the contagiousness rate, all those other things. It's a moving target because as new information comes in, you have to make adjustments. A lot of people in organizations are not used to being agile. They're not used to thinking about how do we do not only plan A and plan B, but plan C, D, or E. And that's something where people in the engineering field, you're much more agile and able to think about those things than most leadership in a large organization. So again, my suggestion is that honesty and transparency about how you approach that is a critical thing for being successful. And admitting when you don't know the answer is also critical. I don't know, but I'll find out. This is something that we don't know. We're looking at the data. We're trying to find out what is going to be the outcome, the trajectory of this infection rate or whatever the case may be. And this pandemic is the first in recent history, but it's not the only one, as you know. Ebola, SARS, MERS, etc. Those are a significant concern for everyone, not just the biomedical engineers, but the clinicians and the leadership of whatever area that's being impacted by. And finally, I would say that we need to think about science and not magical thinking as setting the path of how we approach things. We, in many countries, seem to think that there is a silver bullet, a magic, a vaccine, or whatever that's going to come along and cure everything. You know, that's nice to think that way, but as I said, science and not magical thinking should set the path. Next slide, please. So I think that this sort of sums up some of the concerns that we have in different areas. I don't know much about science, but I know what I like. As the scientist who's given the bad news to the king is headed off with the person who's perhaps not going to do nice things to him. So we have to understand our capabilities, our responsibilities, and we are doing it not only for our own health and safety, but mostly for our patients and those that we love. So I encourage everyone to think about ways of engaging with clinicians, and as was mentioned earlier, you know, don't be intimidated by doctors, don't be intimidated by leadership. Say the right thing, have your facts and understanding to make it a true and valid cause to suggest this is a course of action, and then hopefully the right thing will happen. So next slide, final slide. For questions later on, and I want to thank you for your allowing me to participate and enjoyed the opportunity. Thank you.